Hello everyone, I'm Anas Al-Ubaidi, and the title or the topic for this lecture or session is Common Errors in Documentation and How to Avoid Them within the chapter of Review of Medical Scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. Documentation errors in healthcare refer to inaccuracies or discrepancies or omissions in patient records that can impact patient care and legal compliance. Accurate documentation is the foundation of quality healthcare. Every piece of information recorded in a patient's medical record plays a vital role in guiding diagnoses, treatments, and long term care decisions. Beyond improving clinical outcomes, documentation ensures continuity of care across providers, supports billing and reimbursement, and serves as a legal safeguard in case of disputes. Despite its importance, documentation errors remain a major challenge in healthcare, often leading to miscommunication, delayed treatments, and even patient harm. For medical scribes, maintaining precision in documentation is a primary responsibility as their work directly influences the accuracy and readability of patient records. Professional scribes must also comply with legal and ethical standards, including those established by HIPAA, further underscoring the importance of error-free documentation. Objectives of this lecture: understand the importance of accurate medical documentation for patient safety and legal compliance. Identify common documentation errors and the risks they present. Learn practical solutions and implement best practices to avoid errors in patient records. Apply these lessons within real-world healthcare settings as an advanced medical scribe. Key points. Common documentation errors. Incomplete documentation. Incomplete records occur when vital information such as medical history, allergies, or treatment notes are omitted, potentially leading to inadequate care or misdiagnosis. Description: missing or insufficient documentation that prevents a full understanding of a patient's condition. Example: omitting a patient's allergy to penicillin in the record could lead to administering a drug that causes a severe allergic reaction. Implications can result in delayed or inappropriate treatments and compromised patient safety. Solution here: comprehensive protocols, adopt standardized forms and workflows to include all necessary details, auditing procedures, regularly audit records for completeness and accuracy. And here's a diagram on causes and solutions for incomplete documentation. Eligible documentation. Handwritten or unclear records can create room for misinterpretation and errors. Description here notes that are difficult to read due to poor handwriting or unstandardized abbreviations. For example, misinterpreting QD once daily as QID 4 times daily. And the only difference is QD is for once daily, QID for 4 times daily. Could lead to serious overdose-induced side effects. So instead of reading QD, reading it QID because of handwriting or which might lead to misinterpretation, or the abbreviations wasn't put correctly, QID instead of QD. Implications are medication errors, delayed care, or miscommunications between providers or clinicians. Solution: EHRs or EMRs, electronic health records or electronic medical records, transition to EHR systems for standardized digital documentation. Abbreviation guidelines use universally accepted medical abbreviations and avoid uncommon shorthand. And here is a diagram on medication documentation issues. Inaccurate documentation, errors in data recording, transcription, or updating result in misinformation within the patient's record. Description inaccurate and incorrect or outdated medical details within documentation. Example, entering the wrong medication dosage or failing to record a recent surgery can jeopardize a patient's safety. Implications here: potential medication overdoses, treatment inconsistencies, or liability concerns for providers. Solution: double check processes, implement a second level review system for critical entries. Training programs regularly train staff on EHR usage and documentation standards. Failure to document changes. So patient conditions can evolve quickly, and failure to capture those changes impacts care continuity. Description: omitting updates such as altered medication plans, lab results, or symptoms. Example, failing to update medication dosage might lead to the patient continuing on an incorrect regimen. Implications: missed opportunities for timely interventions and risk of poor patient outcomes. Solution: immediate entry policy, encourage real-time documentation of changes during patient encounters. Communication tools: use tools like patient flow sheets to improve the transmission of updated information to relevant providers or clinicians. Inconsistent documentation, discrepancies in terminology, format, or word choice cause confusion across providers. Description have variations in how information is recorded that create difficulties in interpretation or billing. Example, one clinician documenting GERD while another records heartburn symptoms. As we know, GERD is gastroesophageal reflux disease. Another documentation could be heartburn symptoms, could lead to billing discrepancies or incomplete diagnoses. Implications: higher rates of claim denials and misinformed care plans. Solution: standardized terminology, train scribes to use coding guidelines and unified medical language. Documentation templates, implement structured EHR templates to reduce variability. How to improve clinical documentation consistency, and here's a diagram between as inconsistent documentation versus standardized documentation. Best practices for avoiding documentation errors. We'll start with the use of technology. Technology streamlines the accuracy, legibility, and uniformity of medical records. Electronic health records, EHRs, provide structured formats for data entry, improve legibility, include features like spell check tools and prompts for missing information. Transcription and documentation software converts voice dictation into written notes with high verbal to text accuracy. Example in use: a primary care physician dictates notes and transcription software instantly formats them into the standardized EHR template. Training and education. Continuous education empowers healthcare staff to meet documentation expectations. Regular training. Offer periodic training sessions on emerging EHR technologies and documentation practices. Legal and compliance education. Highlight HIPAA standards and legal requirements for safeguarding documentation integrity. Example in practice: conduct quarterly training on new updates in ICD billing, codes for healthcare providers, and scribes. Audit and feedback mechanisms. Audits detect errors while feedback creates learning opportunities. Regular audits conduct periodic checks on sample records to identify common errors for correction. Real-time feedback provide immediate constructive feedback to scribes if errors in documentation are observed. Example in use: after conducting an audit, the documentation team identifies a recurrent issue with omitted allergy details and schedules targeted training sessions. Examples of clinical application: leveraging EHRs for accuracy. Transitioning a clinic's handwritten records into an EHR reduces incidence of illegibility or illegible documentation. This enables seamless communication between providers sharing patient records. Ongoing training to prevent errors. A hospital conducts monthly workshops to educate the new scribes and staff on the latest EHR features, improving documentation completeness and minimizing outdated entries. Next, we have summary tables, table on common documentation errors, table on best practices for avoiding errors, table on solutions for specific errors, table on impacts of documentation errors, and here's a table on strategies for improvement. Next, we will revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. What is an example of incomplete documentation in healthcare? A. Poor handwriting in patient notes. B. Omitting a patient's allergy information. C. Recording outdated medication information. Or D. Using inconsistent medical terms. The answer is B, as missing critical details like allergies qualifies as incomplete documentation and can lead to adverse outcomes. Question 2. How can illegible documentation be minimized? A. Using handwritten notes for all patient records. B. Adopting electronic health records EHRs. C. Encouraging the use of personal shorthand. Or D. Relying on verbal communication between healthcare providers. The answer is B, definitely EHRs, as EHRs eliminate problems caused by poor handwriting or unclear abbreviations, making records more legible and safer. Question 3. Which error involves not updating patient records with healthcare changes? A. Illegible documentation. B. Failure to document changes. C. Consistent documentation. Or D. Use of outdated transcription methods. And the answer is B. Failure to document changes. As this error occurs when healthcare providers neglect to update records following alterations in the patient's health or treatment. Question 4. What is a recommended practice for avoiding inconsistent documentation? A. Standardizing terminology and training staff. B. Using abbreviations creatively to save time. C. Allowing staff to write in formats they prefer. Or D. Focusing only on key details while ignoring formats. The answer is A. Standardizing terminology and training staff, as standardization ensures uniformity in documentation, reducing errors and confusion. Question 5. Why are regular audits important in documentation practices? A. To identify and correct documentation errors. B. To focus on financial reports instead of patient data. C. To reduce the workload of healthcare providers. Or D. To completely eliminate the use of technology. The answer is A, as regular audits help uncover and rectify errors in patient records, ensuring accuracy and compliance. And here we come to the end of this lecture. Thank you very much and goodbye.